In today's Health Alert, a new coronavirus variant has taken the lead in the United States as cases and hospitalizations increase. The variant, EG.5, nicknamed Eris, was recently added to the World Health Organization's official monitoring list. It's also gaining ground in the UK, France, Japan, and China. Our chief health editor, Dr. Partha Nandi, is here with us. And what can you tell us about this new variant? Is it an offshoot of Omicron? And hopefully we can get past it.
It just keeps going on and on. It's like it's forever, right? So EG.5 is a descendant of Omicron's XBB strains. It has the same genetic makeup of XBB.1.9.2, but carries an additional mutation in what's called the spike protein. That's not great news. Why? Because the spike protein, remember, is what the virus uses to enter human cells. Having said that, there's no evidence so far that suggests that EG.5 is more transmissible or severe compared to other recent variants. Still, we're seeing this strain gain ground. According to the CDC, EG.5 now makes 17.3% of all COVID infections. It's also created its own offshoot called EG.5.1. And this new version added a second change to the spike and is also spreading quickly.
So hospitalizations on the rise, and if EG.5's not behind it, then why are these numbers going up?
And that's why we're worried about it, right? Hospitalizations, it's true, have risen by 12.5%, reaching a total of 9,056. And this increase, Glenda, in cases could be due to a combination of a bunch of things, right? And it could be linked to human behavior. The weather has been blazing hot, we know, in many, many places, forcing folks to go indoors. And normally they wouldn't, right? Increased summer travel is helping the virus spread as people interact with others outside their social circles. Additionally, the reopening of schools in many states, is providing plenty of opportunity for the virus to end, and not to mention the decreasing or waning immunity as it's coming up a year that many Americans received the bivalent booster shot, including myself. And speaking of immunity, right, the updated COVID-19 booster should be available this fall, pending approval from the FDA and the CDC, and this new monovalent shot targets the XBB variant and not the EG.5. However, there's data that shows that this variant-specific boosters can still have an overall impact. So I expect it'll provide good protection, strong protection against hospitalizations and death. Now, I know, right? Lots of people are just tired of hearing about vaccines, but to me, getting the booster is critically important, especially for the elderly and those with compromised immune systems, as they're more at risk for developing severe COVID. And while COVID has not been causing as many deaths, in fact, we're seeing some of the lowest death rate numbers since the start of the pandemic. Great news. But everyone needs to evaluate their own personal risk tolerance and make decisions based on those factors, because we don't know for sure how the virus will behave once fall and winter arrives, cold weather, people getting in, so we have to be vigilant. But we'll keep people, updated on this. And I think you should really, think about getting the booster once it comes out if you're elderly and if you have the risk factors.
Wow. All right, Doc. Hopefully, can we shake this? I mean,
I think it'll become part of our, part of our culture, our medical culture, and I think we can hopefully control it, is what I would say.
Okay. Thank you, Doc.
My pleasure.
If you have a health question for the good doctor, you can email him at drnandy@askdrnandy.com or send it to us on Facebook or Twitter, and we'll get it right to him.